Hello there, John Miller Osteopath here. I'm just talking to you today about tension in the masseter muscle and jaw restrictions. So one thing we often see with people is an inability to open the jaw very wide and a lot of tension and pain in this area here on the side of the jaw. There's a little muscle here called masseter. It's the most powerful muscle in the body for the size that it is, and its job is to help you bite down on things. Very, very useful muscle. There's some other muscles on the inside of the jaw called the pterygoids, and they open the jaw. The only thing is they're not as strong as the masseters. So very often there's a bit of an imbalance that kind of goes on. And sometimes if one side is tighter than the other, you're going to see a deviation towards one side. Now my jaw, because the shape of my head is slightly, you can probably see this, I'm bigger on this side, shorter on this side, there's a compression there. This side tends to be a little bit tighter, and so the jaw deviates slightly this way. Now we don't want to mess the alignment of the jaw up too much, but we do want to improve the function overall. And the way we're going to do this today is by doing a very simple stretch for the jaw. And before you do this, you may want to gently massage the side here. And you can find this quite easily. If you come to the joint line here, open there, you'll feel it open, okay? Come just beneath that point and it becomes a bit softer. And you'll feel around here, there's some tight points. So you just gently massage them. Maybe get a bit of oil on there or cream and just go around there just to get the blood supply going first of all. Once you've done that, we can actually try to increase the range of motion. The way we do this is by opening the jaw as wide as you can and then assisting the opening by pulling down with our hands downwards, okay? And you'll notice that as you pull down, you'll be able to get maybe up to 1 centimetre more in the range of motion of the jaw. Now the way we often test this is by using 3 knuckles like so and seeing how far the jaw will go. If you can get the knuckles in your mouth, you've got a good range of motion. It's a struggle. So we're going to try and work with this. Let's see if we can manage this today. So open nice and wide, hands, and release. Of course, the important thing is also to relax the jaw when you're pulling down. Let everything just come back to normal again. You may need to wait up to 30 seconds. And let's do it again. So open nice and wide and put your hands in and pull down. Release again. Let it just calm down in there. And repeat one more time. And release. So it's not very pretty, but it should be effective. Now let's test it. So open the mouth, take our hands. Aha! We did it. Okay. So it's amazing how much more you can increase your range of motion very, very quickly just by loosening off. You may also finish off, of course, by returning, just doing a little bit of self-massage around here, maybe a minute or two just into there to get the blood supply going. Now, a bit of aftercare advice as well is if you're feeling a bit stressed, obviously you tend to crunch the teeth down together. But if you're also stressed, you want to sometimes offload it. And ironically, offloading your stress and talking about it can be part of the problem to maintaining it. Because as you're talking, especially if you're talking fast, you're using those jaw muscles up and down. And that can actually create more tension in there. So my advice is if you need to talk about the stresses you're undergoing, think about slowing your speed down of your speech and try to say a little bit less as well. And that will really help this to relax. It's actually probably best if you've done a stretch like this to lay down, say 15 to 20 minutes just to rest and just to get your thoughts together. But give this a try and see how you get on. And I'd like to look forward to your comments. Take care. Bye-bye.